Well, hey, everybody, this is Robert, and welcome to today's Outbreak Newscast. Now, health officials in Ohio and Pennsylvania each recently reported on new human infections with novel influenza A variant viruses. In Ohio, officials reported on an infection with an influenza A H1N1 variant virus. The patient had exposure to swine at an agricultural event prior to illness onset. Now, in Pennsylvania, the patient contracted influenza A H1N2 variant and had occupational exposure to swine. Both patients are greater than 18 years of age and developed symptoms and sought health care during the week ending August 10th. Both patients were briefly hospitalized due to underlying medical conditions and have since recovered. No symptoms were reported among close contacts of either case after the case's symptom onset, and no human-to-human transmission related to these cases has been identified. Well, with the addition of these two new cases, that brings the total to 7 variant influenza cases reported during the 2023-2024 season. Pennsylvania has seen 4. They were all H1N2 variants. Michigan and Colorado have reported 1 each, and those were H3N2 variants, and Ohio had the 1 H1N1 variant. Now, since the 2010-2011 flu season, 501 swine flu cases have been reported in the U.S., with the 2011-2012 season seeing the most, with 321 cases in one season. Now, swine influenza is a respiratory disease of pigs caused by type A influenza viruses that regularly cause outbreaks of influenza in pigs. Swine flu viruses do not normally infect humans. However, sporadic human infections with influenza viruses that normally circulate in swine and not people have occurred. When this happens, these viruses are called variant viruses. They also can be denoted by adding a letter, the letter V, to the end of the virus subtype designation. So human infections with H1N1V, H3N2V, and H1N2V viruses have been detected in the United States. Human infections with variant influenza viruses most commonly happen in people with exposure to infected pigs. For example, children near pigs at an agricultural fair, people who raise pigs, or workers in the swine industry. This is thought to happen mainly when an infected pig coughs or sneezes and droplets with the influenza virus in them spread through the air. If these droplets land in the nose or the mouth or are inhaled, a person can become infected. There also is some evidence that people can get infected by touching something that has the virus on it and then touching their own mouth or nose. Scientists are not sure which of these ways of spreading is most common. Now, person-to-person spread of variant influenza viruses is rare. The vast majority of human infections with variant influenza viruses do not result in person-to-person spread. However, each case of variant influenza virus infection should be fully investigated to be sure that such viruses are not spreading in an efficient and ongoing way in people, and to limit further exposure of people to infected animals, if infected animals are identified. Human influenza A viruses can infect pigs and can introduce new influenza A viruses into the pig population. Illness from variant virus infections has mostly been mild with symptoms similar to human seasonal flu. These include fever, lethargy, lack of appetite, coughing, runny nose, sore throat, eye irritation, nausea, vomiting, and diarrhea. While most individuals recover from influenza, including illnesses from variant viruses, these infections can sometimes cause severe disease, including requiring hospitalization and death. If someone experiences respiratory symptoms, they should share any recent exposure to livestock with their doctor so that influenza testing can be considered. The same antiviral drugs used to treat seasonal flu, for example, like Tamiflu, can be used to treat novel influenza A variant viruses in children and adults. These treatments are most effective when taken early in the illness. Now, there's a bunch of preventive actions that can be taken, and these include people at increased risk for severe influenza complications should avoid exposure to pigs. Don't eat, drink, or put anything in your mouth in areas where there's pigs. Don't take toys, pacifiers, cups, baby bottles, strollers, or similar items into areas with pigs. Wash your hands with soap and running water before and after exposure to pigs outside or inside a swine barn. If soap and water are not available, use an alcohol-based hand rub. To further reduce the risk of infection, avoid or minimize contact with pigs in the pig barns and show arenas. When possible, avoid direct contact with pigs that are known or suspected to be sick. If you must come into contact with pigs that may be ill, then wear personal protective equipment or PPE. This includes protective clothing, gloves, and a well-fitting mask that covers your nose and mouth. Parents and caregivers should review considerations for specific groups of people when selecting a respirator or mask for children. Now, if you have a pig, watch for signs of illness like loss of appetite, fever, tiredness, eye redness, discomfort, cough, or runny nose. If you suspect the pig is sick, call a veterinarian. If sick pigs are in an exhibition area, remove them right away. If possible, avoid close contact with sick pigs. Avoid contact with pigs if you have flu symptoms. Wait to have contact with pigs until after 7 days after your illness started, or until you have been without a fever for 24 hours, without the use of fever-reducing medications like Tylenol, for example, whichever is longer. If you must have contact with pigs while you are sick, take the preventive actions we've already discussed. And then for people that are at a higher risk of serious flu complications, these people who do have plans to attend an event or a setting where pigs will be present, such as an agricultural fair, should avoid pigs in swine barns. If people at higher risk cannot avoid exposure to pigs, they should wear a well-fitting mask that covers the nose and mouth. For example, an N95 respirator or a KN95 respirator. People at higher risk of serious flu complications who develop flu symptoms should call a healthcare provider. Tell them, this is key, tell them about your risk factor in any exposure to pigs or swine barns you've had recently. Human seasonal flu vaccines will not protect against influenza A variant viruses that commonly spread in pigs. But prescription influenza antiviral drugs can treat infections with these viruses in people when treatment is started shortly after symptoms begin. Thanks for listening.